Afternoon, everybody, or good morning, everybody. Christine Barconi here in the NBC4i Streaming Center. I wanted to touch base with Dr. Mysheika Roberts this morning after the announcement of the public health advisory, the stay home advisory will go into effect Friday. Dr. Roberts, thank you so much for being with us. We appreciate it. Kind of just want to talk specifics about this. 6 o'clock Friday. Why did you guys choose that? And what do you hope it will help?
Well, we chose to do the public health advisory or the stay-at-home advisory because we're at a critical point in our community. Our case counts are going up, our positivity rates going up, and our hospitals are getting full. And we need to do whatever we can right now to slow the trajectory of the COVID-19 cases in our community. We wanted to give people time to do all the things they need to do to prepare for that stay-at-home order. So we delayed it, and it will start tomorrow at 6 p.m. We believe it complements well with what the governor has done with the curfew that starts this evening, but we really need people to slow down. And by slowing down, reducing their activities, reducing their exposure to others, we're optimistic that we'll be able to bring these numbers down.
Certainly. So speaking of the numbers, we heard from the governor last night. We didn't get the usual 2 p.m. update like we always do from the Ohio Department of Health. They kind of didn't give a specific reason, but kind of just saying that the system really wasn't working at that time. Are you guys overwhelmed at Columbus Public Health with numbers, or are you guys able to submit your numbers? What's going on with you guys? Just maybe to give us some insight with what is going on at the state level.
Yeah, well, that's a good question. I mean, we're definitely getting a lot of cases. I don't want to tell the public we're overwhelmed. We are responding with what the team we have, and we are trucking along. We get our numbers from ODH. That the information they get comes from labs. It goes to Ohio Department of Health through the Ohio Disease Reporting System, and then we get our cases from that system. I'm not certain what the issue was at the state. We didn't experience those issues here, but it's definitely concerning. And I can imagine, the system that we use to report communicable diseases is very old. It was developed before the iPhone. So just take that into consideration when we think about how we're getting this data for COVID-19.
So Thursdays are the days we hear about the county levels. Of course, the majority of the state is under a red. We were starred last week with the threat of going purple. Do you think we'll go purple today? And what does that mean, if anything, now that we have the stay home advisory in place already?
There's definitely a potential that we could go purple today. I put in a text message this morning to Ohio Department of Health asking that question. I have a feeling some of the technical issues they had yesterday might impact their or delay their ability to tell us whether we're purple or not. But that's why we did the stay-at-home advisory. We're trying to do everything we can to prevent going purple. If we go purple, and especially if we continue to see the strain on our hospital system, the stay-at-home advisory may end up turning into a stay-at-home order.
Why do we want to avoid that? I mean, I know it might be necessary, but what are other repercussions that stem from another stay-at-home order?
Well, obviously, the economic implications are huge, and what that does to big businesses, small businesses. We take all of that into consideration. But most importantly, I want to make sure our healthcare infrastructure is intact and is not jeopardized by this pandemic. And so everything we're doing is trying to protect that moving forward.
And we do have, very large hospital systems. We're really lucky to have that here in Columbus and Franklin County. How are the hospitals looking right now? Have you been, I know we heard from administrators yesterday, but from a ground level, these doctors and nurses that are, on the patient floors and in the emergency rooms, have you heard from them? And what are they saying if you have?
Well, I mean, I've heard from the doctors and nurses on the front lines, and I've heard from my own staff who are on the front lines here at Public Health. They're tired. They're worn out. They've been doing this now for 9 months, and there's a lot of fatigue that has set in for them, emotional fatigue, physical fatigue. So we're continuing to work hard. That's why we all went into healthcare, but it's tough. It's tough. And we need people to wear their masks. We need people to keep socially distant and avoid being around others who don't live in their household or who aren't in their bubble. And your bubble should really be getting smaller and smaller right about now, not expanding.
Certainly. So a lot of people are going out and being tested prior to Thanksgiving, and they think that might give them a safety blanket if they do want to gather with their parents, with their grandparents, aunts, uncles, etc. Do you advise that? And if they are taking those steps, what should the logistics be from testing to quarantine to having a meal together on Thursday?
Well, that's a very false sense of security to get tested and come back with a negative result and think that you can go now and socialize and have the holiday with your family and friends. The test result you get is for that day, just that day. That tells me on that day that you got tested, you were negative. And after you got that test result, or after you got that specimen, and if you didn't quarantine, if you didn't hunker down at home away from other people who aren't in your bubble, you could have been exposed again. And then, you could end up getting the virus and spreading it to people over the holiday. So people really need to be mindful of that. That is not how the testing is intended to work. And the recommendation, if anything at all, if people wanted to spend the holidays with their extended family and friends, they should have quarantined 14 days before the holiday and just hunkered down to reduce their exposure to this virus. This virus is everywhere in our community. We're seeing more and more cases coming up here in my department, at the hospitals, really all around the community. I'm hearing from people that said on average we had one case a month. Now we're having one case a week among our staff.
Certainly. Dr. Roberts, so I just actually got a notification not too long ago that Summit County is doing the same thing that we are doing with the stay at home advisory. Do you think it would be wise for other counties, especially the surrounding counties that mingle a lot with Franklin County, to start thinking about doing that as well?
I think that would definitely help if we had support from all of Central Ohio to have a stay at home order. We know that there's no boundaries. I mean, yes, we have a line that says Franklin County, but we know residents go back and forth between those boundaries. So that would be very helpful if we had a Central Ohio stay at home advisory. And I think it would be very beneficial if we had a statewide stay at home advisory.
So talking about these advisories and these orders, of course, we have the mask mandate and we have since July. Uh, we have these advisories. They're very difficult to enforce. Obviously, people aren't going to be arrested. So, what would you say to people who, how do you appeal to people who are saying, I'm just not going to do it? It's not enforceable. You cannot make me. How do you appeal to people?
That's a tough one. I know people feel strongly about not wearing masks. I would say this is a humanitarian effort that we're in right now. We're asking you to do this not only for yourself. We've got data now that proves that masks are beneficial not only for the person wearing it, but for the people around them. So do this for yourself. Do it for your family and friends. It's a minor inconvenience. It's for a short period of time. Granted, I can't tell you how long you're going to be wearing a mask, but it's for a finite period of time. This is not for the rest of your life. This is not for eternity. Please do this for everyone around you as well as yourself so that when we come to the holidays in 2021, those who are with us today will be with us then and we can celebrate together then. I know that it's hard for many people, but I'm actually begging people to wear their mask, keep the distance, not have these large holiday gatherings where they could be exposed to COVID 19.
Saturday is another Buckeye home game here in Columbus. Are you worried about that?
Well, I want people to watch the game at home with the people who live in their household, not have friends over, and stay at home. Follow the stay at home advisory. That's what I'd like to see on Saturday. So it's going to be interesting to see what's happening in our community when the Buckeye game is on. I'll be looking at everything.
Certainly. Yeah, we've definitely seen people kind of standing outside of bars and congregation and different house parties on campus and different things like that. These kids might feel invincible, but what are the actual repercussions of them going out and partying and perhaps contracting the virus?
Well, I think most of our cases are between the ages of 20 and 40, with the vast majority being between the ages of 20 and 29. that young adult, college age kid. And for many of them, they have mild cases, but it's like Russian roulette. There's going to be one out of every four that has a very severe case. I mean, you heard about a case recently, a young, healthy 30-year-old man who got COVID 19 and is likely going to be on oxygen for the rest of their life because they got COVID 19. So you never know how this virus is going to impact you. You might see it in someone else and said, oh, they had a mild disease. If I get it, I'll be okay. But you don't know that. None of us know what will happen if we get COVID 19, how our body will react, how we'll respond, what our symptoms will be like.
Yeah, certainly. Anecdotally, I have a friend who is 28 years old, still experiencing heart issues after he contracted it many, many months ago. So it's not just a here and there situation. You personally know somebody, I personally know somebody who's young and certainly has been affected. If
Okay.
people have their Thanksgivings like they normally do in the coming weeks, what do you think our numbers will look like in Ohio, and do you think our hospitals can handle it?
If people celebrate Thanksgiving the way they traditionally do and don't take all the precautions the way we need them to do, I do anticipate seeing a significant surge across Ohio and really across the nation 2 weeks after Thanksgiving or within 2 weeks after Thanksgiving. And don't forget, we've got other holidays in December. And so as those keep happening and people keep following those unsafe practices, it's going to become overwhelming for our healthcare.
I think it's interesting. You know, the governor has said it many times. The faster the train goes, the harder it's going to be to stop. So if we have this huge outbreak, going into Thanksgiving, and then it seems like Christmas and Hanukkah and all of the other December holidays, perhaps your bubble's got to be even smaller then if we're fighting it worse. So
Yes, yes. We've got to hunker down. We need to do this for the next few months. Once we get over this, once we get the vaccine in the spring and we get more people vaccinated, things are going to be better on the other side. But we've got to make that sacrifice right now to hunker down, to limit our bubble, to stay home, to do only essential functions. And let's get through this tough season so that we can all be available and around on the other side.
one last question for you, Dr. Roberts. Big shopping season coming up. Normally, we see very crowded malls. Even if people are outside at Easton, it's normally a madhouse this time of year. Have you been talking with the big retailers, and what are the discussions you guys have, and how can people protect themselves if they're just trying to get some holiday shopping done over the next month?
Well, I encourage people to try to do holidays with some sense of normalcy, which means exchanging gifts. You can mail them, you can shop online, you can do curbside pickup. You can find stores that have appointments that you can go in and feel safe that have limited people in the stores. Most of our retail outlets have done a great job of really reducing the number of shoppers, encouraging people to wear masks in the store. But we really need to limit our activity. So we need to do as much as we can remotely, curbside as we can over the next several weeks.
Certainly, and maybe picking some things up for your grandma while you're there if you're a young person.
Absolutely.
Yeah. All right, Dr. Roberts, anything else you'd like to add that I may not have asked you just about this advisory that will go into effect tomorrow night?
Now, I just want to remind people that we're all in this together. I know it's tough. It's tough for me too. Things that I enjoy doing, I can't do with comfort anymore because of this virus. So we all have to make a little bit of a sacrifice right now. We have to hunker down. We have to limit our activities. We have to limit our exposures so that we can reduce our numbers and keep our healthcare system intact.
All right, Dr. Roberts, thank you so much. As always, we appreciate your time. Everybody, thank you very much for watching with me this evening. I will have this full interview up on our website, NBC4i.com, in just a few minutes. And then coming up on NBC4 Midday in also a few minutes, we will have a clip of our interview there as well. So we'll see you then. Bye.